Have you ever felt like your body is just a puzzle and none of the pieces seem to fit? You've got this collection of really bizarre, seemingly unrelated symptoms, and doctors just can't seem to connect them. Well, it turns out that sometimes the most confusing health mysteries have one single underlying cause. So today we're going to dive into one of the most complex ones out there.
Maybe this sounds kind of familiar to you. One day, it's hives out of nowhere, and the next, it's this crippling brain fog where you can't even think straight. You feel like you're reacting to everything. But then your allergy tests come back totally normal. It's just exhausting, right? And honestly, it can be really isolating to feel like your own body is turned on you in these completely unpredictable ways. I mean, just look at this list. These symptoms feel so disconnected. You've got brain stuff like brain fog, you've got skin stuff, gut problems, heart palpitations, even things that feel purely psychological like anxiety. But what if these aren't 7 different problems? What if they're all just different expressions, different screams from one single overactive part of your immune system? And that brings us to the first part of our investigation today. We're going to treat this whole thing like a medical mystery. Together, we're going to connect the dots on a condition that just might explain all this body-wide chaos. It's called Mast Cell Activation Syndrome, or MCAS for short.
Yeah, and this is so important to understand. MCAS isn't just about rashes or stomach aches. It has a direct line to your brain. See, the culprits we're about to meet, these things called mast cells, they're actually found in the protective lining around the brain. So when they get overactive there, it can kick up what's called neuroinflammation, which can show up as anxiety, depression, insomnia, and that just maddening brain fog. So no, it's not all in your head, it's in your immune system.
So let's go ahead and introduce the main character in our story. This is the cell at the absolute heart of the entire mystery, the mast cell. In a healthy body, it's a total hero. But in MCAS, well, it becomes a bit of a chaotic anti-hero. I want you to think of mast cells as the security guards of your body. They're strategically placed at all the borders, your skin, your gut, your lungs, and yep, even that lining around your brain. Their job is to be the very first on the scene, to sound the alarm when a real threat, like a parasite or some nasty bacteria, shows up. And their location all over the body, that's the key to why MCAS symptoms can pop up literally anywhere and everywhere. So how do they sound that alarm? Well, they do it by releasing this cocktail of super potent chemicals. We're talking about more than 200 different ones, but some of the major players are right here. When these mast cells get triggered, they degranulate, which is a fancy way of saying they basically just explode and unleash this chemical storm. And it's this storm that causes all the symptoms we've been talking about. And here it is. This is the absolute core of the problem. In MSIC, these security guards have gone completely rogue. They're dysregulated, they're on a hair trigger, they start setting off all the alarms and releasing that chemical storm for no good reason at all, reacting to things that should be totally safe, like a bit of stress, a change in temperature, or even a food they were perfectly fine with yesterday. Okay, now this is where so many people get stuck, and I mean for years. Because all of this, it sounds a whole lot like allergies, doesn't it? Well, this is the biggest red herring in the MCAS mystery, and understanding the difference is absolutely 100% critical. Think of it this way. A traditional allergy is like a nightclub bouncer with a super specific list. Peanut? No, you're not getting in. The reaction is predictable, it's consistent, and it's triggered by a specific immune protein called IgE. MCAS, on the other hand, that's like the entire security system has been hacked. The alarms just go off randomly. The triggers are totally unpredictable. It could be stress, heat, a strong smell, exercise. One day a tomato is fine. The next it causes horrible stomach pain. And that right there is why standard allergy tests so often come back completely normal. For anyone out there who has lived this, who has felt confused or been dismissed because your reactions just don't make any logical sense, this is probably the most important thing to hear. That unpredictability, it isn't you failing to identify your triggers. It is the fundamental nature of the condition itself. So if it's not a standard allergy, then how in the world do you diagnose it? Well, this leads us to the climax of our mystery, a major debate happening inside the medical community that makes getting a diagnosis incredibly difficult for patients. Okay, so basically there are 2 main schools of thought. The first one, we'll call it Consensus 1, is really strict. It requires hard, measurable proof in your blood work during a flare-up, like a specific rise in a chemical called tryptase. The second one, Consensus 2, is more focused on the patient's clinical picture.
It looks at the classic multi-system symptoms and, this is crucial, whether or not the patient actually gets better on mast cell targeting medications. And here's the thing, neither approach is necessarily wrong. They just have different goals and they come with different risks. The strict biomarker approach is great for research studies, but it really risks underdiagnosing people who are clearly sick but just can't catch that biomarker spike in time. The symptom-based approach, though, is better for getting suffering patients faster access to care, but it has the risk of overdiagnosing MCAS when the symptoms might actually be caused by something else. This whole debate is exactly why you could see two different specialists and get two completely different answers.
So after all that complexity and all that confusion, let's talk about hope, because this is not a life sentence of unpredictable misery. There is a clear path forward to calming the storm and actually getting back a sense of control over your life.
Management usually breaks down into three pretty logical steps. First, you get to play detective and try to identify your own personal triggers. Second, you block the effects of that chemical storm using things like H1 and H2 antihistamines. Those are the things that help calm those allergic type reactions. And finally, and this is so important, you use medications called mast cell stabilizers. These drugs actually work to prevent the mast cells from firing off in the first place. It's all about being proactive, not just reactive.
At the end of the day, understanding what is happening in your own body is the key. It's everything. When you can explain the difference between an allergy and a hacked security system, when you get the whole diagnostic debate, you can advocate for yourself so much more effectively and find the right doctor and the right path to feeling better.
And that kind of leaves us with a final thought, doesn't it? MCAS is such a powerful example of the body communicating in a really complex system-wide way. It forces us to ask a much bigger question. In a world with more and more chronic illness, how do we get better at listening to these complex stories our bodies are telling us and trusting those signals, even when, especially when, they don't fit into a neat little box?